Okay, so this is a 360 degree of my area. All right, so my name is Shantae Brown, SHANTAYBROWN. This is my Seneca ID. So currently I have a patient here with me. The patient has a blood pressure of 167/100. The patient heart rate is 107 beats per minute, which is tachycardia. The patient is hypertensive with that blood pressure. The patient temperature is 37, which is normal. Respiratory rate is 20, which is also normal. What I'm going to do is check the patient oxygen saturation, and I'm also going to provide the patient with some fluid. So let's go meet the patient. Hi there.
Hi.
Do you have any form of allergies?
No.
Do you take any form of medication?
Yes, a bunch of them.
Do you have any, how is your appetite?
It's good.
Do you have any abdominal issues or pain?
I have a stomach ache right here in the middle of my stomach.
Okay, how is your bowels?
It's normal.
Do you have any form of cardiac or GI history?
I take up it because my cholesterol is high and it's my blood pressure.
Do you have any chest pain?
I have an ache in my upper chest.
Thank you. Do you have any food intolerance?
Spicy food.
The irregular heart rate, is it happening now or is it something that normally happens?
No, but I take it might be fast right now.
Do you have any nausea and vomiting?
I'm nauseous and I did vomit once.
All right, so I would do a full pain assessment of the patient to assess the patient pain. Now, looking at the patient, I do see that the patient appears to be a bit unwell. The patient is diaphoretic. I do see bilateral edema, and also there is increased work of breathing. The patient behavior is normal. However, the patient has a bit of dyspnea when the patient is talking. There's no visible pulsation. The patient's skin is dry, cyanotic, and pale. So what I'm going to be now is I'm going to be palpating the patient pulses to make sure that they're all present. All right, we're starting with the carotid. Lift your neck up. Okay, so carotid pulse is present. All right, now we're doing brachial. Brachial pulses are present. Now we're going to be doing radial. Radial pulses are present. Now we're going to be checking cap refill. So cap refill is less than 3 seconds. Now we're going to be doing the dorsal pedis. So dorsal pedis pulses are present. We're going to be checking the cap refill for the toe, and they are less than 3 seconds. So what we're going to be doing next is I'm going to be auscultating the patient's heart. Now we're going to be listening for S1s, S2s, and any form of murmurs that I may hear upon auscultation. All right, so we're going to be using the diaphragm firstly. All right, so we're going to come down here to the second intercostal space on the right. And the first one we're going to hear, we're going to be listening to the aortic pulse. Then we're going to come over to the second intercostal space to the left. Here we would find the pulmonic coming down to the third intercostal space. This is where I would find the tricuspid valve. Then I'm going to come down, the Erb's point at the third, Then at the fourth, I'm going to find the tricuspid valve. At the fifth, I'm going to find the mitral valve. Now at the mitral valve, I'm going to be auscultating for the apical pulse. This is where you get the most accurate reading for a patient that has any form of irregular heart rate or murmurs. That's where you would check for a full minute. Now I'm going to be turning over the diaphragm. Now I'm going to be listening for murmurs. Now murmurs sound like a whooshing or swooshing sound. So we're going to go again, second intercostal space. So we're going to do the aortic. Then we're going to come down over here, pulmonic at the second intercostal space to the left. Now we have Erb's point. Now we're going to come down here. We have the tricuspid valve. And then over here we have the mitral valve, which is fifth intercostal space, but this one is mid-clavicular. So I did hear all S1s and S2 are present, and I don't hear any form of S3s, S4s, or even any form of murmurs. So what we're going to do now is that we're going to be assessing the patient's abdomen. I'm just going to get you to... All right, now upon inspection, I do notice that the normal contour of the patient's stomach is round. The umbilicus is midline. I do see symmetry, and it is midline. The skin is a bit pale. There are a few tuni-sized bruises on the patient's abdomen. I also noticed some scars, which appears to be from a surgical scar. So what we're going to be doing now is auscultating the patient the patient abdomen. We're going to be starting in the right lower quadrant. So in the right low, and we're going to be going clockwise. In the right lower quadrant is where I would listen for the liver. In the right upper quadrant, right lower quadrant is where I find the appendix. The right upper quadrant is where I find the liver. In the left upper quadrant is where I'll find the stomach, and in the left lower quadrant I'll find the descending colon. So I do hear all those sounds are present and normal active. So what I'm going to be doing is I'm going to be percussing the patient So what I'm going to be doing is starting in the right lower, and I'm going to be going in a counterclockwise to stay away from the area with the pain. So we're going to start here. Now, what we're going to be listening for is dullness in areas, for instance, that has the liver, and also in other areas you're going to hear general tympani in those other areas. Okay, perfect. So what we're going to be doing now is we're going to be palpating the patient abdomen. I'm going to be using 3 to 4 fingers, and I'm going to be going 1 to 2 centimeters deep. Now I'm not feeling, what I'm looking for is if there's any form of mass or there's any form of general tenderness. Now I do know see a bit of grimace once I go through the upper epigastric area. All right, good. All right, so there's no form of masses. I didn't feel any form of masses. There's normal sound. So I will just do my S-bar now. So the situation is I have a 65-year-old female who reported feeling unwell this morning. The patient reported feeling a bit of chest pain, some abdominal pain, and also epigastric pain. The patient has a history of hypertension. The patient also is diabetic. What I'm doing upon assessment, all bowel sounds are present. There is pain upon palpation. There didn't in the upper epigastric area. The patient has no. There's grimace also. All cardiac sounds are also present. No, there is edema. The patient looks a bit diaphoretic. The patient look a bit pale. What I do advise is that the physician will come and look at the patient. Also to provide me with measures to comfort the patient to help decrease the patient pain. What I'm going to do, what I think is happening, the patient is having some form of cardiac issue. What I will do for nursing, especially to help with the blood pressure, is I'm going to provide the patient with some fluid to help lower the blood pressure. I'll also provide the patient with an area so that the area is calm, to reduce anxiety and also to reduce the cardiac workload. What I think the doctor is going to order some blood tests to check the troponin levels. He must also order an ECG to check to see if the patient is having some form of cardiac issue.